There were 21,151 cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and more than 148,000 COVID tests were reported during that period. Sadly, New South Wales Health is reporting the deaths of 6 people. Can I express my sincere condolences to the families for the loss of their loved ones? Whilst we're reporting 21,151 cases in the community, it's likely that the case numbers are higher than that, and there is a lot of transmission of COVID occurring in our community, and so the risk of transmission and acquiring COVID is high, and we can do some simple things to reduce that risk over this New Year period. One of the most effective ways is just to choose the venue when we're socialising, so choose well-ventilated spaces, preferably outdoors, and as much as possible try and limit your size of your social gatherings. Rapid antigen testing before a gathering can be an additional precaution, and consider using that particularly if you're going to meet up with a lot of people, particularly in indoor settings, or you're going to be meeting up with people that are elderly or have underlying health conditions. And I understand that availability is variable, but if you have got them with you or you can access them readily, we really are encouraging their use. Continue to check in to those with the New South Wales Health check-in app where it's available. Continue to wear those masks where they're required and practice that physical distancing. But most importantly, if you have the most minimal of symptoms, I'm asking you to please to stay home. Isolate and get a test. That will keep your loved ones safe from further transmission and help slow the spread of COVID in our community. In terms of testing, appreciate the efforts of the community in bearing with us as there's been some significant challenges getting through the testing. We are working with our pathology providers and doing all we can to turn around those tests as soon as possible. But we do want to limit our PCR testing to those that fit into certain categories. So people that have got COVID symptoms, get a PCR test, isolate until they've got a negative result. Also, if you've been in a household of a case, please get a PCR test. And also if we've otherwise advised that you need a PCR test. But we do want to discourage testing if you don't have symptoms unless you fall into those high-risk categories.